Now I'm going to turn it over to Michael Moloney, who is an employee. You can look at this story from Danielle and many of Danielle's colleagues who may be playing something similar to that. Michael's also a...
It's working.
It's working. So you're ready to go. Thank you.
I want to thank Isabel and Danielle. I really can't follow those powerful stories. If anything, I'm just kind of emphasize or underline what they say. So HMEA, we support 2,500 people with developmental disabilities. For some of the new folks here, developmental disability is something like autism or Down syndrome or cerebral palsy. The youngest person we serve is 1. The oldest is 94. So I really love my job. Like many of you in the audience, we've seen people with disabilities move from the institutions to the community, which has been great. There's 2 things I hate about my job. One is every month I sign a check for $187,000 to Harvard Pilgrim Healthcare, money that should be going into services. The thing I hate the most of all, though, is every single year telling people like Daniela and Isabella that not only did you not get a raise, but you're going to have a different healthcare carrier, and by the way, your benefits are going to be watered down. You're going to get a less product for more money. So let me tell you about our organization a little bit in terms of the financial dilemma that we face. Over the last 3 years, our budgets have been cut $650,000, okay, $650,000. But on the other side, our healthcare went up by $650,000. So that awful symmetry puts you in the hole about $1.3 million. The thing about healthcare is it's predictable, it goes up. So in this coming year, we expect to be cut by about $200,000. And our healthcare goes up, has gone up 62% in the last 5 years. It'll go up another $200,000. So you can do the math. That's not a business that stays in business. So what we do as an organization, we eat as much as we can. We eat a lot of the healthcare increases, but what we do is pass on poor products to staff, which really, really doesn't work. That's where the math, in this state we believe in universality. We know that passes the constitutionality test, but it doesn't pass, it flunks the mathematics test. Our HR person, I asked her to do a little study. Our staff bring home $18,750 a year. That's a direct support staff, professional. That means about $1,600 a month. So our HR person looked at the cost of living in this part of the state. It would cost about at the end of the day, with food and clothing and all of that kind of stuff, you're left with $22 at the end of the month before buying health care. So the numbers don't work, and for our staff, life doesn't work. We're constantly talking about stressed staff in our environment, who are workers, people who take care of people with disabilities. We're talking about people who can't get their car fixed, people who can't pay their rent. People have to make choices about medication. I know of one provider where for an individual plan, it costs $200 a month out of pocket. There's also a $2,000 deductible in that plan, which is a non-plan. Somebody's shaking their head. So that's $4,400 a year if you're to use health care. So the numbers don't work at all for people. So what are the solutions? I think as providers, we have some things available to us that we didn't used to have in the future. With 2 other organizations, we're looking at, you've heard wellness, but we do have the ability now to offer incentives for people making healthy lifestyle choices, for people stopping smoking and things like that. We're also going to be investing in risk management programs where people we know a lot of our employees are going to develop chronic illness because of certain lifestyle, can't afford food, can't afford health care and things like that. We're going to be investing in some of those programs. We're looking at the YMCA to work with our staff in terms of fitness, nutrition, personal training, that kind of thing. We've also developed a relationship with a yoga studio, believe it or not. Staff love the stress management. The people we support benefit a lot, but the staff who are working 2 jobs really need that ability to chill out. So, what do we need from legislators? I'm really happy to say that we live in Massachusetts. Every single day this week, I've read in the paper about putting caps on certain things, about accountable care organizations. I'm extremely happy to hear Blue Cross and partners talk about cost control. I think because we were first out of the gate with universal health care, the governor and the legislature has done a really good job about considering cost control options. Well, what we need affordability, of course, but we need two other things. We need predictability, and we also need simplicity. What happens in an agency like mine, if 3 or 4 people have a significant illness, rates can go up by as much as 30%. I know, however, in the GIC, rates go up a lot less, below 10%. So again, we would like to see ourselves be part of a larger pool, and there's 3 different bills to promote that. Simplicity. I don't know if other providers have the same challenge we have, but every year we change healthcare providers to save money. So we've gone from Fallon to Blue to Harvard to Tufts. I have a master's degree. The HR person reports to me. My wife works in healthcare, and I can't figure it out from year to year because we switch so much. So we need some simplicity in our programs. Fully 40% of our staff come from countries around the world. If a guy who's lived in Massachusetts for 30 years can't figure it out, it's very tough for our really committed staff to figure it out. So please help support legislation that gives us affordability, predictability, and some simplicity. But finally, even if we pull off the Massachusetts miracle, right now we have the highest healthcare costs in the country. I know together we can get high quality at much lower costs. But at the end of the day, if staff don't have a bigger paycheck, we've collectively failed. So I ask you to support the healthcare legislation, the bills that we're promoting to get us involved in a bigger pool, but please also support the salary reserve. Thank you.